Hello, welcome to the Fertility Talk Show. I am Dr. Love, and you're welcome to July's edition. This month of July is celebrated world over as World IVF Day. That happens on the 25th of July every year. It is also known as World Embryologist Day. Here at Law Foundation, we are joining that celebration by focusing this month's talk show on IVF and embryology at its well. And today on the show, we have a specialist in that field. He is the chief embryologist at the NISA Prime Fertility Center for Harcourt. His name is Mr. Isah. Good morning, sir, and welcome.
Thank you.
Embryologists are very rare people. You hardly see them all over the place. They are very busy, and we are very honored that he has given us a few minutes to just enlighten you, viewers, on what IVF and embryology is about. Welcome again, sir.
Thank you.
So we'll just get right to you because you know you're very good. We would like you to just talk to us briefly about the history of IVF here in Nigeria and just a few things that people need to know, how the journey started and where we are so far.
Yeah, IVF in Nigeria there's actually a controversy there
Okay.
about who started IVF first, who was successful, and
Okay.
who did not get it right at the time they started.
Okay.
There's a controversy. Professor Giwa Osagi
Okay.
and his team from Lagos, at a point, that was in 1986.
Wow, as far back as 1986. Okay.
I don't want to go into detail, but I'll talk about the one I am sure of.
Okay.
So for Professor Giwa Osagi, they said they had a baby in 1986.
Okay.
Although that was how everything ended there, because for me, I don't know the baby and I don't want to go into detail.
Okay.
But Dr. Wada of Nisa Premier Hospital, Abuja,
Okay.
had the baby. His own breakthrough was in 1998, February 11th.
February 11th.
Yes, when the first IVF baby was born. And actually, at that point, the federal government was aware. They even sent a delegation to the clinic for verification.
Oh, okay.
Yeah, so on record, as it stands now, that is the one I know and I can talk about. That's on record.
Okay.
That I can talk about. And today, because that was the first baby born from IVF and on record, yeah. So Dr. Wada decided that the child will be on scholarship until, as we talk today, the baby is no longer a baby again. Yeah, she's now a doctor.
Wow.
And that was what Dr. Wada promised from the beginning.
Wow. Okay.
He will make sure he mentors this child to become a baby, to become a doctor.
Okay.
And if possible, train her on IVF. Yeah. So that when she's talking to a patient, I'm doing a testimony. So I think they have a foundation too. Occasionally they run low cost IVF for those that cannot afford so they do something like promo. Not really promo, but low cost.
Oh, that's interesting. So IVF in Nigeria started as far back on record at 1998. That's quite some time.
Yeah.
Over 20 years of practice. Yes, definitely over 20 years of practice now. And we have had success stories.
Yes.
One tells about the successes. A lot of people are still biased about the success rate of IVF. People still say it's a 50-50 thing. It doesn't always work. In short, most of the time it doesn't work. It only works by chance. Can you just throw some light on that?
IVF is not just a 50-50.
Okay.
There are some centers, but globally, you can say it's a 50-50 because some clinics have high success rate, some have low success rate.
Okay, so
depending on a lot of factors.
Yeah. Yes. Okay.
When you talk about a gynecologist, will take to explain that one because the way some clinics prepare their patients for embryo transfer, IVF generally, is different. So a lot of things play a role in it. Yeah.
In achieving the success.
Okay. Exactly.
So is it possible to just throw a few light on what these differences are that allows for one party to have some high success rate and another party not to enjoy that.
It's not as if they are not enjoying. It depends on the knowledge of the person in charge.
Okay.
And that's why training and retraining is important in every field, especially this IVF. One, it is expensive.
Yes.
It is not something the patient can just come and just run a procedure, go and come back again. Yeah. Some people sell a lot of properties. Some people save money. Some people take loan or borrow money to do this. Yeah. You know, there are different stages.
Okay.
If you prepare a patient, there is the minimum thickness of the endometrium, yes, that is required.
Okay.
If you did not get to that range, it's a problem. And if it is above that too, it is not. So there is a range.
Okay.
Yes.
Okay.
So then the drug use, then the personnel involved.
Okay.
You look at the cultural environment. So we culture the embryo in the incubator.
Yes.
The incubator is just to mimic the womb, which is the uterus.
Yes, so I think
it's not actually the environment.
This point is very, very important because when you say incubate, an incubator, there might be some bias.
It's actually designed to mimic the natural environment
of the womb.
Okay. It cannot be 100%. It's just to look like it.
Okay.
So if there's any variation during this period, that you culture this embryo in the incubator, maybe like the temperature change, the gases, CO2 or oxygen change there can affect the development.
Yeah. And all of this at the end of the day goes a long way to determine whether the embryo is safe or not. So that's very insightful. So tell us a little bit about embryologists and the role they play in the entire IVF process. First of all, congratulations, happy World Embryologist Day.
Thank you very much.
And let people know a little more about, I think embryologists are the superheroes behind IVF. I think the world agrees, or even gynecologists agree on that. So tell us a little bit about the role that embryologists play in the entire IVF.
Like in the IVF, embryologists are like the engine house of the clinic.
Okay.
That does not mean that they are the only important thing in their personnel in IVF. Okay. Even the cleaners, they are very important. If the right soap or detergent is not used, if the place is not cleaned properly the way it should be, it affects the outcome. Okay. So the nurses that administer the drugs, the doctor that is in charge of taking decisions of everything, at each of these points, if anything is done wrong, it affects it. But then why some people still say the embryologist is the engine house is because after all the stimulation and everything, we are the ones to identify the eggs during egg collection. The doctor gives you follicular fluid. We identify the eggs there. Then we prepare them, culture them, even the sperm, prepare sperm. Some treatment require ICSI, which is intracytoplasmic sperm injection. In this case, for those with low sperm count, we prepare the sperm and we inject directly into the egg so that fertilization can be achieved. After the fertilization, is the embryologist that will still check the fertilized eggs, which is the zygote at this point. Then culture until the day of transfer. Sometimes we do the 3 transfer or the 5 transfer. For the 2, the 3, depending on the number of embryos generated. For instance, like in our own clinic, if we generate like 2 or 3 eggs, embryos after fertilization. So there's no point keeping them to the 5 for transfer. If you know that you're going to transfer 2 embryos, what is the need keeping it outside
The
the womb for too long.
Okay.
But for patients with up to like 5, 10, 20, or once it's above 5,
Okay.
we keep them until day 5 so that we can select the best blastocysts to transfer into the uterus.
Okay, that makes sense. All right. Okay. So the embryologist is in charge of all this.
Yeah, this particular period.
Watching the embryos as they grow, determining the best ones to transfer back into the womb. Do they actually do the transfer themselves?
No, all what we do is we select the best embryos. We load the embryos and hand it over to the gynecologist.
Who does the transfer into the uterus? That has been very interesting and insightful. So for people who are skeptical about the IVF procedure, or particularly IVF in Nigeria, what can you say on a day like this to encourage them?
I can only tell them that whatever they are going to do abroad,
Okay.
people still come from there to Nigeria to do.
That is interesting. Okay.
The same technology that is used over there is the same technology we use here.
And it's fully available.
Yes.
We are not outsourcing anything.
No.
Okay.
Just that we are not producing them in Nigeria. Okay. We import almost everything, even down to the water we use to clean our surfaces.
Are you serious?
They are all imported here.
Okay. Okay, but at least once we have them, we can replicate
every
yes.
step. All of us have training from over there.
Yes. Okay.
Like when I was employed, I started my journey in 2007.
Okay.
I was trained in-house.
Okay.
And from then we go training abroad and come back. Sometimes maybe like 2 persons from the team of IVF go for training, and when they come back, we learn from them. Then another group will go again, then come back, the others learn from them. Yes, it's true.
And the beautiful thing about medicine is that once you have the technique, it's somehow like mathematics. Once you have the formula, you can always replicate the answer. And it's interesting to know that people actually come from outside the country to seek care here. So you've had cases like that in the clinic, and they have successes and go back pregnant to their baby.
I can't mention names here, but there are so many of them that come for training different countries, Australia, US, even UK. Okay. These are the places we still go for training. So
and they come down here to receive. So eventually it's cheaper for them.
Exactly. It's cheaper for them.
Okay, so that's interesting. So IVF is working. Yeah. And what you have said that is very key is that preparation is key. Preparation on the part of the personnel, preparation on the part of the fertility.
Even the patient.
And then the patient. This part is the part that a lot of people don't want to hear. A lot of times patients think that the entire IVF process is in the hands of doctors, the embryologists, the medical team. Exactly. What can you say about patient responsibility towards that? Success.
Patient responsibility. One, you have to work with your anxiety. And if you are asked to take this drug by 10 a.m., make sure you follow it up. Okay. Take it the time you are asked to take. If you are asked to be in the clinic the time you're supposed to be, try and make sure you be in the clinic at that point. Whatever they tell you, nobody wants to stress a patient here. Whatever we are doing is for the success of the treatment. Okay. Yeah. So there are some patients that they need to work on themselves because some of them are under pressure. Like when you talk to them, they have the information they want you to tell them. And that is what they are listening to, even when you are not mentioning it. That is the only thing they hear. That is the only thing in their mind. So when you tell them do this, do that, they may not remember to do. Because some of them, exactly. Some of them may even argue with you that this was what you said. Because that is what they are thinking. Okay. The patient may come and tell this patient that, okay, because of this parameter, you need to go for donor egg. They tell you they believe their God is able to do it. Maybe their pastor is telling them to take anointing oil or communion and the rest. Yes, there's a place of God and there's a place for medicine. So when you delay, it's like you are running from the evil day. You still come back to that evil day someday. So it is one rule that the patient to play, yes.
So it's important for patients to listen to the medical team and follow their own directives, not to come with their own set of instructions or the procedure that they are not running. Okay, that's very important. So we want to say a very big thank you to you guys for giving us this time and then this level of enlightenment, because I think it has helped to debunk some of the uncertainties and beliefs that some people have in them.
Yes, and I want to say something.
Okay.
You see, this IVF, they need to do a lot of orientation and reorientation.
Yes.
There are some persons that come to do IVF in clinics,
Okay.
but they don't want to be identified with IVF.
That is true.
There are some patients, you see them in public, you greet them. They feel if they answer you, people will know that yes, they came to do IVF. So they behave like they don't even know you. And there's nothing wrong with IVF. You see, God will not come down to do some of these things by himself. The knowledge for IVF is from God.
Yes, I totally agree.
Everything we do here, nobody manufactures sperm, nobody manufactures egg.
Nobody allows the implantation to take place.
You see, on the day we finish our embryo transfer, that is the end of science. God takes over. If God says there won't be fertilization, there will not even be. If God said there should be fertilization, but no division, no development, it cannot happen. So we are not doing it. We are not claiming God here. We are only trying to use what God has given us.
Which is the knowledge. Okay. This is so powerful. Thank you so very much for this, especially this last part that you're emphasizing on. It's really true. It is one of the reasons why we are super excited that this year the AFRH is having an open house where patients can actually come in and learn firsthand. Because the truth is that a lot of stories just go around. You wonder where these stories are coming from, but it is just people manufacturing information on their own and maybe making it trend, I don't know, and then just dishing out wrong truths, as it were, about the procedure and practice itself. So thank you very much for enlightening us. We want to be well done on all the good works you are doing, and may God continue to strengthen you to do. Thank you very much. So there you have it, our dear viewers. You have heard from the horse's mouth, as it were. The embryologist, who is the specialist in charge of the IVF process, has told us all you need to know. The facility has its own responsibility, but you also, as the patient, have your own responsibility. So if you have decided to go for IVF, of course, we know that IVF is not the only pathway to treat fertility challenges, but if you have decided that IVF is the way you want to go, there are important information you need to have, important facts you must know. How do you decide the facility to use? How do you choose your medical team? What must you do in preparation for your IVF procedure? These are the information that you can get from Love Foundation if you are following us. So we encourage you, follow us on all our social media handles. We are on Facebook, Instagram, TikTok, and YouTube at Love Foundation. You can also send us an email if you need to maybe know more or have some more interactions on info@lovefoundationg.com. If you want to have a physical consultation where you talk to somebody one-on-one, counseling, fertility counseling, or just to get more information, you can reach us on WhatsApp on 081 75 809. However you want to get information, just get it, because if you know more, you can do more. We are super excited about the upcoming AFRH Open House. AFRH is the Association for Fertility and Reproductive Health, and every year they have a conference where they gather professionals in the field of fertility and just discuss about the new technologies, what's happening in the industry, what people need to know, but usually based just or focused on professionals, doctors, embryologists, gynecologists, fertility experts, fertility counselors, all those in the fertility support organization. That is their thing. But this year, for the first time ever, they will be having an open house where they will be open to the public, people who want to get information, learn, interact with these professionals and get first-hand information, all they need to know about fertility treatment, where they can source it, the different kinds available, cost ranges. So you no longer need to just assume things. We invite you to the AFRH Open House happening on the 23rd of September 2025. Follow us for the registration link. It is absolutely free. So from all of us here at Law Foundation, we want to say thank you for joining us for July's edition, and to come your way again with another interesting topic in the next edition. Stay blessed, keep learning, and learn to teach others. Bye-bye.